Kia ora tātou, ko Vicktoria Blake Tokawangoa, ko Aotearoa kai hautu whakauka moho wara atoi. I am Vicktoria Blake Sustainability Manager, as Dagan just said, at Bay of Plenty District Health Board, and this is Jeremy Levy. Just in case you didn't got us mixed up or something, I thought it would be good to do that. So we're actually going to try to break out of hospitals a little bit and change it up for the last session today. And so what we're going to talk about is the problem that we face in Tauranga City. We have the highest use of private cars in Australasia, increasing traffic flows 8% each year. The Tauranga City carbon footprint, 61% is made up of transport, with 97% of that being road transport. So as you can see from the top three images, so those are three of our real pressure points in congestion. So congestion is a problem for a number of reasons. It actually has quite severe impacts on our mental health. It has severe impacts on our economy. And so, you know, these issues are real. The other issues that we also have is that is the barriers to mode shift. So if you have a look in the bottom left-hand corner, we don't have safe and sufficient infrastructure for mode shift. And image one on the bottom there turned into image two and has on more than one occasion. The other thing is that we don't have good engagement in our public transport system. So this is a pretty common scene in our buses in Tauranga City. And just taking it back to the DHB for a moment, 62% of our staff at Bay of Plenty District Health Board live within 10 kilometres of the hospital, half of those within 5 kilometres. However, 92% of staff commute by car, 85% of that in single occupancy vehicles. The numbers are similar for patient and visitor travel, except only 56% are single occupancy. We only have 2% public transport engagement across both patient and visitor and staff commute, and about 9% walking and or cycling on occasion. So you've seen a similar image to this. Sandy put one up from Northland DHB, and it's a similar story in Auckland DHB as well. Here, the green is our measured carbon footprint. The light blue is our estimated patient and visitor travel carbon footprint, and the darker blue there being our estimated staff commute. So we would be, from the total carbon footprint, transport carbon footprint across our entire rohe for our DHB, we make up 3% of that footprint, which is actually pretty huge. And we also, so we're having impacts from us, so impacts onto the congestion, public health issues, environmental issues, but also impacts on. So congestion obviously impacts on emergency services, and those congestion points that I showed you in the previous slide show you how hard it is for our emergency services to be able to move around those pressure points. So that obviously impacts on response times, as well as lack of parking, lack of access. So we have a bunch, you know, no-shows and outpatients and things like that. So it actually has an impact on the services that we provide. So why are we interested in this project, in this problem? Obviously, there's public health outcomes from active travel and mode shift, air pollution. We've talked about this, so I'm not going to go into detail. One of the things we do forget to mention sometimes is staff wellness and resilience. So I am lucky enough to live close enough and with safe enough cycleways to be able to bike to work, and I do quite often, and I feel so good. Oh my goodness, it's so nice to bike to work. And we forget actually the wellness that we get, not just from being a bit active, but also in our mental wellness from being able to engage in active transport. And it is something that we should be considering as we do have more and more pressures on our staff, and resilience can be so low, particularly for us with our Whakatane hospital staff, with Whakaari, tsunami, number, like we've all got pressures, but I think Whakatane Hospital in particular has been through quite a lot of stresses in the past 12 months. And to my friend.
So you probably wonder why I'm here, because, you know, Trustpower has very little to do with health, but we suffer the same problems in terms of transport. Trustpower is really interested, personally, probably in transportation, because part of the solution is very likely to be electrification of transport. We do electricity, we have a part to play, and that's really when we first got engaged in this kind of transport space. But when it comes to Tauranga, we enjoy a 60% market share. We're very well supported by our local community in Tauranga. And all of our staff also, you know, we have to travel around the city. So we suffer from all of those problems. So I wanted to come and talk a little bit about what's going on. How have we got here? So the root cause of everything is population growth. go back 20 years when I went to Tauranga, and we didn't have congestion issues. Yes, we were 99% private motor vehicles, but we were basically a town, and it works. So we carried that kind of, you carry it through, too many people, overloaded networks, doesn't work, and you get all the poor outcomes that we've been talking about. In terms of getting there, well, we were a small town and we thought like one, and we acted like one. And so when you behave like a small town, you elect officials and you expect your planners who've been planning for decades, and it works. So we'll just do more of the same. Of course, we didn't call it sprawl and congest as the option for our transport future in our city. Right, clearly not. We called it smart growth because we were doing smart stuff and things worked, and we'll just keep doing them. And so we've ended up sort of in that position. So out of that policy and planning, of course, we build possibly the wrong infrastructure and maybe not enough infrastructure at times. And that then leads back round to the behavioural stuff. No one in Tauranga actually thinks they should have to take a bus, right? Because I never used to have to. So why should I start taking a bus now? You guys just build some more roads. And look, all those buses are empty. Why don't you just stop running them and use that money to build some more roads? So we get this cycle, and it's a combination. And in fact, we've actually got not a bad bus service now. So some of our councils have done a really good job and been quite courageous and spent quite a lot of money providing services that run every 20 minutes. And they've stuck to it even when lots of people said, look, they're empty, no one's using them. But it's that combination of the way we're behaving and the infrastructure we've got that actually leads to a poor network performance. So that's really where our problem is sitting, is that combination of behaviour and stuff. Unfortunately, it's a complex system. Now, Vicktoria told me you're all really, really smart. So I can take just like 1 minute per slide, which is my allotted time frame, and to jam a few years worth of, academic research into like a minute, and you guys will keep up. So I boiled it down to, I guess, 2 things that I really think it's important to understand about systems theories and complex systems. The first one is equilibrium. They're really hard to change. You can push them in a direction, but they tend to just settle back to the way they are and the way they were. And it's just they're actually very, very hard to change. So there's sort of equilibrium. And seemingly almost completely inconsistent with that, they're what they're called chaotic, or there's a chaos. And a lot of you probably heard of the chaos theory, or the butterfly effect is probably the most famous example. Within the weather system, a very small change in starting circumstances can lead to a very different outcome. And in the case of the butterfly effect, butterfly flaps its wings, you think makes no real difference, but as a direct result of that, there's a tornado in the US. So that's kind of that. How does that fit together? Well, after your storm is over, everything's back the way it always was, back to your equilibrium. So what we're really facing from the combination of equilibrium and chaos is that it's hard to change, and you get a whole bunch of unintended consequences. So back to that cycle, right? In order to deal with this, we need to be all over that bad boy. And so that's no one organisation. We're not about thinking that someone else solves this problem. We all have a part to play. No one organisation, you can't say council should do this or this, that. So we want to do the bits that we can. And that's what the pledge is all about. Those organisations that are prepared to do the bits that they can as things are at the moment. And we have got a lot of very important organisations already joined up with us. But it's not a solution either, right? That's not, oh, we're just coming together to do this thing. It's a process. You have to learn from trying things. You're going to get unintended consequences. You need to collaborate to get across all of that. And when you have winners, the collaboration allows you to leverage that and multiply it out. So for our pledge is really all about running this process. And we've organised ourselves as a group, hopefully that can just be about action. So the membership are collaborating, taking initiatives, doing actions, working together, sharing ideas. In the background, we have a very small organising committee, very lightweight, that just facilitates that and makes it happen.
So I just got a few things. So some of the aims for the Greater Tauranga Travel Pledge, we're basically trying to reduce carbon and environmental footprint, enhance accessibility so that we can move around our city and improve public health and wellbeing through our active and low emissions transport. We aim to understand and manage our approach as organisations, including flexible working, supporting active transport where we can and enabling it, and investigating and implementing other forms of low emissions and active transport, such as EV transition. And we need to do that collectively as well. We need to have an EV charging network across our region. We can't just put chargers in at the hospital level. We're a new organisation. I don't know, I can't think of a better word, group of people. We've got 9 signatories so far, but we have 20 engaged. You know, we have made some changes and we're doing some things together, but I think the thing that is really important here is that we in DHBs tend to work in silos. We work in silos within our own DHB, we work in silos within our own departments, within our own hospital, within our own DHB. And I think it is time that we start looking outside of our sector even, and start asking questions, well, what are you doing about this? Because it might not work for us, but it might. We might be able to take one little thread of what that idea is and make it work for us. I've got heaps more to say, but I'm going to stop there because I've seen my number come up. But yeah, we have to work together. We cannot do this alone. We cannot do it in isolation. We need systems change. We need a whole paradigm shift in the way that we do travel and transport.